Well, effects from these stories can be felt right here in southeast Wisconsin, especially in the time of this pandemic, because we're also seeing a high number of coronavirus deaths in communities of color. So let's talk about that right now. Joining us today is Reggie Moore, director of Milwaukee's Office of Violence Prevention, and mental health clinician Dominique Pritchett, CEO of the Love Wellness Center in Kenosha. Thank you both for joining us. Reggie, let me start with you. Before COVID-19, you were already sounding the code red about a trauma epidemic in Milwaukee from all that we have been seeing here. Now, add in the impact of COVID-19 on the African-American community. And what now? Where do we go?
Right. Like we say, we can't go back to normal because normal was abnormal in terms of when you look at the disparities in our city, when you look at the disparities in our country, whether it relates to health in terms of pre-existing conditions, but also the pre-existing conditions in our neighborhoods and in our cities as it relates to mass incarceration, unemployment, systemic violence, as we've seen witnessed this week. All of these things have been with us and unfortunately have gone and under addressed in our country.
So, Reggie, when you see that they've gone unattended, knowing what you were up against before COVID-19, what gives you any hope that things will change, knowing that the situation actually got worse?
Right. We really have to have a reckoning as a country to understand and as a community where we look at what does a just and equitable recovery look like? Because again, when we look at what has been lost during this pandemic, we've lost elders in our community, we've lost leaders, we've lost businesses, we've lost jobs that people may not be able to return to. And so when we look at the impact of this pandemic, both immediate and long term, it's not just about getting back to where we were. We have to have a recovery that centers people that have been most impacted in the center of that recovery and ensuring that the resources and supports are placed in neighborhoods and communities where they're greatest needed.
So, Dominique, let me ask you about that. We hear about all these government programs, billions of federal dollars to help people. But from your wellness center, do you see that flowing fast enough to help people with this crisis?
Well, definitely not. I think the number of individuals that are now dealing with complex and layers of trauma right now, it just doesn't seem that there is enough dollars to serve everyone. Many agencies are really stretched very thin, but going off hope, we have to keep pushing forward and continue to advocate for more dollars in Black and Brown communities.
So when you look at what you're up against for the next 30 to 60 days, for the rest of this year, Dominique, what would you say you need right now?
We need people to speak up. We need people who have funders or resources out there. We need advocates. We need boots on the ground because silent voices are not being heard. So we need Black and Brown communities to be resilient. So there is a shared responsibility that we have to be resilient because that's what we have as a people. But those individuals who are not Black and Brown, it's time to stand up and speak up.
So to Reggie and Dominique, we appreciate you both talking about this. This is an important conversation, and we hope to have you back to talk more about it. Thank you.